Question 1. Which of the following is an example of an epidemic? A, blindness, B, eczema, C, influenza, D, tetanus. In this question, your keyword is epidemic. When you see epidemic, we're looking for small scale spreading. We also need something, a disease that is communicable, which means it can be spread from person to person by contact, fluids, or the air. So blindness does not meet those criteria. It is not spread, it's not a communicable disease. Eczema is not a communicable disease. Tetanus is not a communicable disease. Influenza is the only answer choice listed that is a communicable disease. It is spread through the air and through contact. It is an example of a disease that could become an epidemic. Number 2, which of the following is not a preventative measure taken by the CDC to control the spread of an epidemic? Your keyword in this is not. It means the CDC would not do it. So let's look at our answer choices. We've got A, quarantine, which is when we isolate people. You've got B, immunization, which is what we get to prevent people from getting sick. We have early and aggressive treatment of ill people. So this is going to be a containment measure. And we've got mass distribution of hand sanitizer and Lysol wipes. That's going to be prevention and containment. So we have to look at the answer that would be what the CDC would not do if an epidemic were to break out. Well, they're certainly going to quarantine people. We're going to isolate the sick so that they don't spread it. We're going to encourage anybody who's not sick to get immunized, if in fact it's a viral disease, so that those people don't get sick. So that can't be the answer because that's something that the CDC would do. Early and aggressive treatment of ill people, we're going to find those sick people, we're going to treat them, and that way they can't spread it. So that's certainly something the CDC would do. Mass distribution of hand sanitizer and Lysol wipes, while that isn't a totally ridiculous answer, that's not what the CDC is going to do in the event of an epidemic. So the correct answer is D. Number 3, what's the difference between a pandemic and an epidemic? So here we know that a pandemic is global. It's worldwide. And an epidemic is in a small region, like the United States, or just in Europe, or just in Africa. So question A, they can be used interchangeably. No, the fact that we say there's a difference between the two means you can't use them interchangeably. A pandemic is an epidemic that spreads to multiple countries or even worldwide. So here we've got our keyword worldwide. We know that a pandemic is in fact worldwide, so the correct answer is B. Let's look at why the answer is not at C or D. A pandemic is an epidemic that causes more than 1,000 deaths in one region. Again, one region describes an epidemic, not a pandemic. And a pandemic affects multiple animal species, not just humans. That's just a ridiculous answer. So the correct answer is B. Number 4, which of the following patients would be considered to have acquired a disease transmitted by a vector? For this question, you have to know what a vector is. A vector is an organism, and an organism is something that's living that transmits diseases but does not get sick from the disease. So a burn patient develops a Pseudomonas infection while in hydrotherapy in the hospital. What happened with this one? Is there an organism that's involved that carried the infection and then passed it along? Nope, the burn patient just got it while at the hospital. A person steps on a nail in a garden and develops tetanus. In this case, nail is not a living thing. It's not an organism, so the nail cannot be a vector. A person is bitten by a tick and develops Rocky Mountain spotted fever. In this case, a tick is a living thing. It passed it along to the person and they got Rocky Mountain spotted fever. That means that C is the correct answer. A child develops measles while at school. Again, we don't have another organism transmitting the disease, so the correct answer is C. Number 5, what is an epidemic that is widely distributed called? Your key word in this problem is widely distributed. Folks, when you see widely distributed, global, or worldwide, you should automatically think pandemic. So as we look at our answer choices, we've got A, endemic. Y'all, we haven't even talked about something called an endemic, so that's probably not the answer. B, pandemic. C, common source epidemic. We never called anything a common source epidemic. That can't be the answer. D, prodromal. Again, never talked about anything like that. So just eliminating the ones that we've never discussed, it brings you to B, pandemic. Number 6, the occurrence of a disease in unusually high numbers in a localized region is called a, in this question, localized is your key word. When we see local, we think epidemic. So, right now, I want you to take just a second. If you didn't know it was an epidemic, I want you to take just a second to mark out the one answer we know it cannot be. I hope you marked out prodemic because we've never even talked about something called a prodemic. That leaves you with epidemic, pandemic, and Spanish flu. We know that a pandemic is worldwide, so that can't be the answer. That leaves us with epidemic and Spanish flu. At this point, you have to know that epidemic is localized. It's in one small region. That gives me the answer as A. Number 7, which of the following statements is true concerning epidemic diseases? Again, we got to find our keyword. In this case, our keyword is epidemic. We're looking for localized. We're looking for just a specific area. So let's look at our answer choices. A, they are usually not very contagious. The fact that they become an epidemic means that they are contagious. That's what allows them to spread. So we know that A cannot be the answer. B, at the end of an epidemic, a disease spreads at an increasing rate and then abruptly disappears. Nah, maybe. We'll leave it for now. C, they usually appear and disappear seasonally. D, they only occur in underdeveloped countries. Well, I can tell you now, and you should know from class, that the flu is an example of an epidemic. We have flu epidemics every year in the United States, so we know that D cannot be the answer. So when I give away my clue of the flu is an epidemic, that's going to lead us to the best answer being C. They usually appear and disappear seasonally. So the flu comes around anywhere between October and March, and then over the summer we don't worry about the flu. Number 7 is C.